Let us move on to the second type of receptors which are also involved in the rapid control of blood pressure. These are the chemoreceptors. So, chemoreceptors are activated when your mean arterial pressure falls below 80 millimeter mercury. So, their area of control overlaps with the area of control of baroreceptors, since baroreceptors can help you, or they are activated when the blood pressure falls as low as 60 millimeter mercury. So, the chemoreceptors are overlapping with the baroreceptor control, and they help in consolidating the control of the baroreceptors. So, chemoreceptors do not respond to stretch. As the name indicates, they are chemical receptors and they respond to chemical changes such as decreased oxygen, increased carbon dioxide and increased hydrogen ions. And where are these chemoreceptors present? They are present in the carotid and aortic bodies. As I mentioned before, that it is a body which is present at the bifurcation of the common carotid artery, and you do not have to confuse it with the carotid sinus, which is just a dilation, while carotid body is a separate body, round oval shaped body which is present at the bifurcation of the common carotid artery, and within this carotid body there are present chemoreceptors. These chemoreceptors detect changes in chemicals like oxygen, carbon dioxide and hydrogen ions. So, in this figure you can see that where the common carotid artery bifurcates into the internal carotid artery and the external carotid artery, there is present a small body which is known as the carotid body. Similar bodies are present within the arch of aorta, and these are known as the aortic bodies. Suppose suddenly there is a fall in the mean arterial pressure. Okay, there is a fall in the blood pressure, mean arterial pressure, and the blood which is coming to the aortic bodies and then to the carotid bodies has reduced pressure than normal. Since this body is very rich in chemoreceptors, it is suddenly going to detect that the blood which is coming to it has reduced pressure because it is carrying lesser than normal concentration of oxygen. It can only respond to chemicals such as oxygen, hydrogen ions and carbon dioxide. So what it first detects is that there is reduced oxygen which is coming to it per minute or per second, and what then later it detects is that the pressure of blood which is coming to it is not enough to wash away all of its carbon dioxide and hydrogen ions, and these carbon dioxide and hydrogen ions become accumulated in this body. So these high concentrations of hydrogen ions and carbon dioxide ions and decreased concentration of oxygen is detected by the carotid body and the aortic body, and these two bodies send their signals to the medulla nucleus of tractus solitarius, and nucleus of tractus solitarius realizes that the blood pressure has fallen, and to raise it back towards normal, your nucleus of tractus solitarius is going to cause vasoconstriction, increased heart rate and increased contractility of the heart by activating your cardiac acceleratory area and vasoconstrictor area. These changes are going to raise the blood pressure back towards normal. So this is how your chemoreceptors work. The same is shown here in this flow chart, that whenever there is decreased arterial pressure, mean arterial pressure less than 93.3, there is going to be decreased oxygen and increased carbon dioxide and hydrogen concentrations within the carotid body and the aortic bodies, and the chemoreceptors in these bodies are going to become stimulated. They are going to send impulses through the hearing and glossopharyngeal nerves and the vagus nerve to the nucleus of tractus solitarius, and there is going to be vasoconstriction, increased heart rate and increased heart contractility, which is going to raise the arterial pressure back towards normal. So this is the flow chart of events which take place when there is decreased arterial pressure. Opposite would happen if the arterial pressure is increased, and opposite effects are going to take place to reduce the arterial pressure back towards normal. Thirdly, we have a very important response which is known as the CNS ischemic response. In this response, this response is activated when your arterial pressure falls to very dangerous values. So this mechanism is activated in very dire situations when your mean arterial pressure falls below 60 millimeter mercury. It is extremely stimulated or very strong when the arterial pressure falls as low as 15 to 20 millimeter mercury. So it is a very dire situation. If special steps are not taken, this may lead to death. So you can call it your body's last efforts to regain the arterial pressure. So it is also known as the last ditch stand, which is a military term, as the soldiers, they dig ditches between themselves and their enemies to keep the enemies away. So it is the body's last ditch to keep death away. So what happens is when the arterial pressure falls to such low values such as 15 to 20 millimeter mercury, this pressure is not enough to keep the blood flowing to your special organs, especially your brain. And when your brain starts to experience hypoxia and the blood pressure there falls and the blood flow to your brain, especially your brainstem falls, what happens is there starts to accumulate carbon dioxide and lactic acid and citric acid within your vasomotor areas, and there is reduced oxygen and nutrient supply to this area. So what happens is this loss of supply results in activation of severe vasoconstriction in all vessels of your body, and increased heart rate and increased contractility, so that your blood pressure can be maintained and blood can be supplied to your brain so it can keep you alive. Okay, so when your mean arterial pressure falls as low as 15 to 20 millimeter mercury, your CNS ischemic response is activated. Why is it activated? Because the brainstem is not getting enough oxygen, and there is accumulation of hydrogen ions and carbon dioxide ions. These carbon dioxide and hydrogen ions are directly going to stimulate your vasoconstrictor area and cardiac acceleratory area, and they are going to cause vasoconstriction in your body and increased heart rate and increased heart contractility, so the blood pressure can be raised to for the survival of the body, to keep the body alive. This is known as CNS ischemic response. There is another mechanism which is known as the Cushing's reaction. Cushing's reaction is in fact a type of CNS ischemic response. But what happens in Cushing's reaction is that there is increased intracranial pressure. Okay, so Cushing's reaction is a type of CNS ischemic response, but what happens is it may be in Cushing reaction also there is decreased arterial supply and decreased blood supply to the vasomotor areas. But what is the reason? The reason is increased intracranial pressure. There is raised pressure within your skull, within your cranium, and the reason for this can be any tumor or any cancerous growth or any or raised production of the CSF or your cerebrospinal fluid, or there is blockage or of drainage of CSF, and CSF starts to accumulate within your brain, and this causes raised intracranial pressure. Now what happens is, as you already know, that if this is your skull, the bony part of your cranium, and your brain lies within it, and there are present blood vessels between the brain and the skull. If there is raised intracranial pressure, it is going to push your brain or swell your brain, and it is going to push it against the cranium. What this is going to do is it is going to occlude these blood vessels which are present between the brain and the skull. So whenever there is raised intracranial pressure, your blood vessels are going to be squeezed against your skull, and they are going to be occluded, and they will not be able to supply blood to your brain tissues, especially your vasomotor areas. And this is going to result in CNS ischemia and CNS ischemic response. But what is the cause? The cause is raised intracranial pressure, which can be due to cancers or tumors, or which can be due to increased cerebrospinal fluid within your brain. So this is the Cushing's reaction, which is a type of CNS ischemic response. Next we have the Bain-Bridge reflex. It is also known as the atrial reflex. It is different from the reflexes we have previously studied because this is a positive feedback. This is a positive feedback, while previously we have studied all the reflexes which were negative feedback regulated. This Bain-Bridge reflex is regulated by positive feedback. Now how this happens, let us study. So as I mentioned that Bain-Bridge reflex is a positive feedback reflex. What happens in Bain-Bridge reflex is that whenever there is increased blood pressure, as a result, the Bain-Bridge reflex is going to be activated, which is going to result in further increase in heart rate and heart contractility. So you can see that it is opposite to what we have studied before. Why does this happen? This happens because it is a protective reflex for the heart. It protects the heart itself from damage. Now what happens is when there is increased pressure within the heart, it causes the walls of the heart to stretch, especially the walls of right atrium to stretch because atrium is thin walled. When the right atrium stretches, you know that there is present SA node in the walls of right atrium. When the walls of the right atrium will stretch, the walls of SA node will also stretch, and when SA node is stretched, it becomes stimulated. It starts firing at a greater rate. So first effect of raised blood pressure is stretch of SA node, which results in increased firing of SA node and causing increased heart rate. The second effect is when there is increased arterial pressure, it causes the walls of the atria to stretch. Other than the SA node, there are present some receptors within the walls of atria, which are mechanoreceptors. When these receptors are stretched, they send signals to the nucleus of tractus solitarius, and nucleus of tractus solitarius causes increased heart rate and contractility of the heart, and this causes increased blood to be pumped out of the heart, and this is known as Bain-Bridge reflex. Now why does Bain-Bridge reflex take place? It is a protective mechanism for heart. What happens is when large quantities of blood with high pressure are entering the heart, we do not want this blood to be accumulated within the heart or to stretch the heart to such great values that the elastic tissue of the heart is damaged. So to protect the heart, there is increased heart rate and contractility, so all that blood which is coming to the heart can be pumped out of the heart. So this Bain-Bridge reflex is in fact protective reflex for the heart, and it prevents the damming up of blood within the arteries and veins of the pulmonary circulation. Okay, so this is the Bain-Bridge reflex. It is very, very important, and you might be asked what is Bain-Bridge reflex in your vivas and in your written exams as well. So you have to remember what Bain-Bridge reflex is. It is a positive feedback reflex. It increases heart rate and contractility in response to high pressures of blood. It does this by two mechanisms. The first is by direct stretch of the SA node and increased firing of the SA node, which increases the heart rate. The other is through the vagus nerve, through the mechanoreceptors which are present in your atria, which send signals through the vagus nerve to your brain, which results in increased heart rate and increased heart contractility. Okay, so it protects your heart and it avoids any pooling of blood within the lungs or within the heart. This is known as the Bainbridge reflex. Okay, so after Bainbridge reflex, we have the atrial and pulmonary artery reflex. It is very much like the baroreceptor reflex, only the receptors are present in the walls of your pulmonary artery and atria. So whenever there is increased blood pressure or blood volume, these receptors which are present in the walls of atria and in the walls of the pulmonary artery are going to be stretched. They are going to send signals to your nucleus of tractus solitarius, which in return is going to reduce the blood pressure back towards normal. So you just need to remember the name of this reflex. Secondly, we have an abdominal compression reflex. What it does is that whenever there is an activation of baroreceptors or chemoreceptors due to reduced blood pressure, the nucleus of tractus solitarius is going to send signals to the muscles of your abdomen to make them contract. When your abdominal muscles contract, they are going to compress your liver, your spleen, and other veins within your abdomen. And when these organs which contain high quantities of blood, large quantities of blood, and these veins which are going to be squeezed or compressed, the blood is going to move towards the heart and it is going to increase the venous return. And when the venous return increases, the cardiac output also increases, and this is going to increase the blood pressure back towards the normal. So in the end, I have two questions as I promised before. These are two commonly asked questions. Let us discuss them one by one. First of all, the first question is, what reflex is involved in regulating blood pressure on changing posture from sitting to standing position? Give its mechanism. As I mentioned before, that when you are sitting or lying and you suddenly stand up, your blood pressure suddenly falls. This is known as orthostatic hypotension. But you do not faint every time you stand up. Why is that? Because there is a mechanism within your body which suddenly acts and raises your blood pressure back towards normal. So the reflex involved is the baroreceptor reflex, and in this question you have to explain the baroreceptor reflex and how it works with example. Second question we have is, a person after suffering a road traffic accident was brought to a medical emergency. His blood pressure was 70 by 30 millimeter mercury. Which mechanism is activated in his body to maintain his arterial pressure? So now we know that there is going to be one of the mechanisms which we recently studied which is involved in maintaining his blood pressure. But which mechanism would be involved? As I mentioned before, that our mean arterial pressure is around 93 millimeter mercury, and we have baroreceptors which act in a range of 60 millimeter mercury to 210 millimeter mercury, isn't it? Okay, 210 to 60 millimeter mercury. And then we have CNS ischemic response, which acts from 60 millimeter mercury to 15 millimeter mercury. Okay, so we have baroreceptors which act from 10 millimeter mercury to 60 millimeter mercury, and then we have the CNS ischemic response which works from 60 millimeter mercury to around 15 to 20 millimeter mercury. So whenever your blood pressure reduces from 93 to around 60 millimeter mercury, within this range your baroreceptors are going to be activated. When your mean arterial pressure falls below 60 millimeter mercury, your CNS ischemic response is going to be activated. So let's see which response is being activated in this case. The blood pressure given here is 70 by 30, which means 70 is the systolic blood pressure and 30 is the diastolic blood pressure. Now you have to calculate the mean arterial pressure. and what I need you to do is calculate the mean arterial pressure, find out what is the mean arterial pressure, and decide which mechanism is going to be activated in this person. Please leave your answers in the comment box with your roll number so your attendance can be marked.